Hi, my names are Tumelo, ELINA, Mauta, and I'm here to talk to you about Dyshidrotic Eczema. But before I talk to you about it, let's start with the organ that it affects, the skin. The skin is the largest organ in the body, and the skin is about 2 square meters and weighs about 16% of your body weight. Okay, the skin is made out of 2 main layers and 1 underlying layer. The first layer would be the epidermis, the outermost layer. Underneath the epidermis is the dermis, where you'll find connective tissue, blood vessels, nerves, hair follicles, oil glands, and sweat glands, just to mention a few. And lastly, in the hypodermis is the hypodermis, right? Though it is not a part of the skin, it does attach the underlying organs to the skin. This layer mainly consists of fatty cells. Okay, so functions of the skin include the regulation of body temperature, protection from physical abrasions, bacterial invasions, dehydration, and ultraviolet rays. Sensation to stimulus such as temperature, touch, pain, and pressure, excretion of excess water, and the removing of some heat through sweat, immunity, blood reservoirs, and vitamin D. Okay, so now to talk about dyshidrotic eczema, also known as dehydrosis or acute palmoplantar eczema or pamphlix. It is a non-contagious skin infection. This disease is mostly common in adults between the ages of 20 and 40, and about 5 to 20% of hand dermatitis cases are dehydrotic eczema. Okay, so symptoms include tiny itchy blisters developed on the palms of hands, sides of fingers, or on the soles of your feet. Okay, in some severe cases, the blisters can be found on the backside of the hands, limbs, and on the feet. Okay, so dehydrotic eczema is likely to be caused by an allergic reaction. This disease heals in about 3 to 4 weeks, on its own, but if you do exhibit red itchy skin for more than a week, it is advised to go and see your doctor or dermatologist. For treatment of this disease, you can use home remedies such as washing your hands with warm water instead of using hot water, applying a cool compress 2 to 4 times each day for up to 15 minutes. This will help reduce discomfort and the itchiness. Moisturize your hands frequently to improve dry skin. And for medical treatment, your doctors may prescribe some topical corticosteroids or oral antihistamines. And for some severe cases, they may give you UV light therapy. Okay, there is no one way in preventing dehydrotic eczema, but there are ways to reduce the likeliness of getting the disease, such as the reduction of stress, and avoid exposing yourself to metal salts such as cobalt and nickel. Practicing skincare routines like using mouth cleansers and lukewarm water to wash your hands and dry them, moisturizing your hands regularly, and once in a while wearing some gloves. We have come to the end of my presentation. Thank you very much for watching.